The 6 daily supplements I am about to talk about will definitely make you change your mind about your blood pressure. They have absolutely nothing to do with the piles of Western medicine you are trying to swallow every day. Do you know why? There is a truth that few people tell you. Western medicine only lowers the numbers on the monitor. It absolutely does not repair damaged blood vessel walls. When a cerebral blood vessel ruptures, the ultimate pain is not death. It is when you wake up discovering you are paralyzed on one side of your body. You cannot go to the toilet by yourself, dress yourself, or clearly call your loved ones' names. From an independent person, you permanently lose your freedom. You have to lie in one place, becoming a massive financial burden and draining the energy of your own children. Let me tell you about a 65-year-old patient of mine. He was extremely disciplined, not missing a single dose of blood pressure medication for 5 years. His numbers every morning were always stable, making him certain he was safe. Sadly, he still had to be hospitalized in the emergency room for a stroke. A study from the American Heart Association, AHA, has clearly proven using only blood pressure lowering medication is not enough to prevent arterial stiffness caused by nutritional deficiency. In this patient, the ultrasound results showed that his blood vessel walls were severely calcified due to a lack of magnesium and vitamin K2. The Western medicine pill only hides the symptoms, while the blockage inside still silently destroys. The blind faith in that single method almost took his life. From the story above, we need to clearly understand a medical phenomenon called the calcium paradox. When past the age of 60, you often supplement calcium to prevent osteoporosis. But if there is a lack of vitamin K2, calcium will not go into the bones, but will deposit directly onto the blood vessel walls. This causes the blood vessels to become calcified, stiffened, and very prone to cracking and rupturing. The Rotterdam study, tracking 5,000 older adults over 10 years, has proven people with enough vitamin K2 reduced arterial calcification by 52% and the risk of death from heart disease by 57%. K2 performs the essential task of transferring calcium from the blood vessels back to the bones. Furthermore, the American Journal of Cardiology also clearly pointed out when the body lacks magnesium, the muscle layers surrounding the blood vessels will continuously spasm. This condition directly pushes blood pressure to spike. Regardless of the fact that you have been eating a low-salt diet, Western medicine only helps dilate blood vessels temporarily. To clean up the calcified deposits and truly restore flexibility to the blood vessel walls, you are strictly required to provide enough of these natural micronutrients. The good news is you can completely prevent this. Today, I am here to bring practical medical knowledge, helping you protect your cardiovascular health and live independently for a long time. Hit subscribe now, and please watch until the end of this video, because you will know exactly the 6 micronutrients that restore blood vessel flexibility, the precise dosage specifically for older adults, how to safely combine them with the Western medicine you are using. Stay until the end to understand how nutrition can support vascular health, improve circulation, reduce risks, and empower you with simple daily habits for long-term cardiovascular protection naturally and safely. Let me tell you about a clinical case I personally treated recently. It was a woman in her early 70s. Like many at this stage of life, she carried an invisible, haunting fear, the terror of severe osteoporosis, and the lingering anxiety that a single slip in the bathroom could leave her permanently in a wheelchair. In a proactive effort to protect herself, she purchased high-dose calcium supplements, taking them with extreme discipline every morning for 3 years. She was immensely proud, firmly believing she was doing the right thing. Convinced her skeletal system was encased in a solid layer of armor. However, a few months ago, she walked into my clinic looking alarmingly pale, She continuously clutched her chest due to severe shortness of breath. Her heartbeat was highly erratic, and her blood pressure was dangerously stuck at 160/90. Upon reviewing her CT scan, she broke down completely. Her bone density had not improved at all. Terrifyingly, her heart valves and aortic arteries were heavily speckled with dense white plaques of calcification. Her blood vessels had effectively frozen solid. Trembling, she asked doctor, "I only wanted to protect my bones. Why have my heart and blood vessels turned to stone?" This woman's heartbreaking condition is a crystal clear testament to a real documented medical phenomenon called the calcium paradox. When you ingest standard calcium pills, the calcium is rapidly absorbed into your bloodstream. However, the biological issue is that raw calcium cannot independently navigate into your bone structure. For your living bones to successfully absorb this circulating calcium, your body strictly requires an adequate supply of vitamin K2 to act as the essential cellular transporter. If you are deficient in crucial vitamin K2, the excess unabsorbed calcium remains trapped, circulating uselessly in your blood. Eventually, this floating calcium deposits itself and tightly adheres directly onto the sensitive inner walls of your blood vessels. Over time, this accumulating calcium layer grows thicker, causing your blood vessels to become severely calcified. They lose their natural elasticity, becoming dangerously rigid and stiff. When your vital blood pathways narrow and harden like this, your heart is forcefully compelled to work significantly harder to pump blood through restricted passages. This continuous strain directly triggers your blood pressure to spike to exceedingly dangerous levels. The innocent act of taking calcium solely to prevent osteoporosis tragically transforms into the exact root cause of severe cardiovascular hardening. Please, do not continue to self-prescribe and blindly swallow calcium supplements without a specific medical directive. I strongly urge you to bring your current bottle of calcium directly to your physician during your next scheduled appointment. Relying on the precise results of your blood test, clearly ask your doctor, do you biologically have a legitimate calcium deficiency? Do you genuinely require additional vitamin K2 supplementation to prevent calcium from dangerously clinging to your blood vessels? At this vulnerable age, absolutely every medication or daily supplement must be evaluated and formally decided by a medical professional. If you stubbornly continue consuming supplements incorrectly, your entire cardiovascular network will inevitably suffer devastating, severe damage. Having rigid blood vessels due to extreme calcium buildup is already exceptionally dangerous. But there is another massive, equally critical hidden issue lurking. Right now, a large number of older adults are habitually taking a highly popular daily supplement, blindly believing it benefits their heart health. But the terrifying scientific truth is, if you consume a substandard version of this supplement, it aggressively inflicts severe damage upon the inner lining of your fragile blood vessels. It triggers widespread inflammation, causes lethal blood clots, and forcefully drives up blood pressure. So, what exactly is this popular yet destructive mystery pill? To full cheap fish oil and oxidative stress, fish oil omega-3 is often considered a supplement that supports cardiovascular health, but its actual effectiveness depends greatly on product quality. Some low-cost types may contain low levels of omega-3, be partially oxidized, or contaminated with impurities, which significantly reduces their cardiovascular benefits. Therefore, older adults should not only look at the number of capsules they take, but must also pay attention to the product's origin, purity level, and safety certifications. It is important to understand that not all fish oil products on the market provide the same level of benefit. Two bottles that look identical on the outside can have very different internal quality. One may be fresh, highly purified, and properly processed, while another may have been stored for a long time or produced with lower standards. In such cases, simply increasing dosage does not necessarily improve results because the core issue lies in quality rather than quantity. What you may not know is that fish oil is one of the types of fats that is extremely prone to oxidation when exposed to air, light, or high temperatures. This oxidation process causes the oil to degrade, lose its original beneficial properties, and form harmful compounds. In reality, many large bottle, low-cost products may already begin to deteriorate even while still sitting on store shelves. Oxidation is a chemical reaction where unsaturated fats in fish oil react with oxygen. Because omega-3 fatty acids are highly unsaturated, they are particularly sensitive and unstable. When oxidation occurs, the molecular structure of the oil changes. Instead of supporting cellular health and reducing inflammation, the degraded oil may lose its intended function and even produce byproducts that are biologically stressful to the body. When the body absorbs oxidized fish oil, instead of supporting cardiovascular health, it may actually increase oxidative stress within the bloodstream. This leads to the formation of free radicals, which are unstable molecules that can damage the endothelial lining of blood vessels. The endothelium is a very thin but extremely important layer that helps regulate blood flow, vascular tone, and overall vascular health. When this vascular lining becomes irritated or damaged, the body responds with an inflammatory reaction. Inflammation is a natural defense mechanism, but when it becomes chronic or excessive, it can lead to negative effects. In this case, inflammation causes the blood vessels to constrict or narrow, which reduces smooth blood circulation throughout the body. As the blood vessels become more constricted, the heart is forced to work harder to pump blood through the narrowed pathways. This increased workload places additional strain on the cardiovascular system over time. When the heart continuously compensates for reduced circulation efficiency, it may contribute to a gradual increase in blood pressure. Over the long term, repeated exposure to oxidized fats and persistent oxidative stress can create a cycle. Oxidative damage leads to inflammation. Inflammation leads to vascular narrowing. And vascular narrowing leads to increased cardiac workload. This is why the quality and freshness of fish oil supplements are critically important, especially for older adults who already have a higher risk of cardiovascular issues. In summary, fish oil itself is not inherently harmful. In fact, high-quality omega-3 is widely recognized for its benefits. However, when the product is of low quality, oxidized, or poorly stored, its expected benefits may be significantly reduced, and in some cases, it may even contribute to internal oxidative stress rather than preventing it. Additionally, consumers should be aware that proper storage conditions play a key role in maintaining stability, including keeping products away from heat, humidity, and direct sunlight. Freshness indicators such as manufacturing date, expiration date, and packaging integrity are also important factors to consider when selecting a supplement for long-term cardiovascular support. 3. Taking vitamin D alone and calcium accumulation. Many people diligently take vitamin D on a regular daily basis, yet their blood pressure stubbornly remains high. Please do not rush to worry, panic, or harshly blame yourself. The frustrating fact that your blood pressure does not drop is absolutely not because your body is inherently weak or failing, and you have certainly not done anything wrong at all. This specific condition is simply a vital piece of medical information. It is precisely the way your body is actively trying to communicate and tell you that it is currently lacking another crucial accompanying substance to effectively process and utilize this specific amount of vitamin D You are merely lacking a comprehensive and complete medical guideline. Let us view this unreduced blood pressure reading not as a failure, but as a highly practical, actionable signal for us to immediately correct the way you take your supplements so that it is right. Vitamin D has a very clear and distinct biological role, helping your digestive system maximize the efficient absorption of calcium directly from your food and delivering that entire absorbed amount of calcium straight into your circulating bloodstream. However, the critical mission of vitamin D simply stops right there. It is completely and biologically incapable of independently transferring this massive amount of calcium from the blood into the deep structure of your living bones. As previously mentioned, for this calcium to successfully enter the bones, the human body is strictly required to have an adequate supply of vitamin K2 to act as the primary transportation vehicle. If you only take vitamin D alone without the crucial presence of vitamin K2, a large excess amount of calcium will be hopelessly trapped and continuously float around aimlessly within your bloodstream. The greatest and most severe medical risk occurs when this excess, unguided amount of calcium passes through delicate blood vessels that are currently damaged. If the sensitive intercellular membrane of your blood vessels is already swollen and highly inflamed due to the negative impact of consuming low-quality fish oil, this rogue calcium will directly deposit and tightly adhere itself to those exact microscopic damage locations. The underlying state of inflammation actively causes the calcium to stagnate and harden into dense, solid plaques right on the inner vessel walls. This dangerous layer of plaque grows increasingly and progressively thicker, causing the vital space inside the blood vessels to narrow significantly and the once flexible blood vessel membranes to become dangerously rigid and hardened. In the specific areas heavily coated with these calcium plaques, passing blood cells can very easily get trapped and clumped together, highly increasing the lethal risk of suddenly forming dangerous blood clots. When vital blood vessels are severely narrowed, completely lose their crucial natural elasticity, and have active blood clots present, it becomes exceptionally difficult for blood to smoothly circulate. To maintain the life-saving blood supply to nourish the entire body, the heart muscle is forcefully compelled to contract and pump with a much stronger mechanical force than normal, just to desperately squeeze the vital blood through these heavily restricted sections. The direct, unavoidable consequence of this intense cardiovascular strain is that your resting blood pressure will be pushed up to exceedingly dangerous heights. Please check the exact ingredients on your specific vitamin D bottle right now. If the product label strictly only says vitamin D or D3 without the clear inclusion of vitamin K2, please temporarily stop taking it immediately. Continuing to use vitamin D completely alone will only actively increase the dangerous amount of calcium accumulating within your delicate blood vessel walls. Please safely bring that specific bottle directly to your doctor to be advised once again on exactly how to take it properly, fully ensuring the calcium safely leaves your blood vessels and goes straight into your structural bones. When fragile blood vessels severely narrow due to thick calcium plaques, your blood pressure will undoubtedly and inevitably spike because they are so incredibly worried. Many older adults arbitrarily buy rapid, fast-acting vasodilating pills to forcibly lower their blood pressure, but they absolutely do not know that artificially forcing a fragile blood vessel segment that is currently swollen, heavily inflamed, and deeply hardened to dilate abruptly is an extremely dangerous, potentially fatal medical risk. What exactly is the actual terrifying physiological consequence of doing this? 4. L-arginine and blood pressure fluctuations. The next cause that may make your blood pressure suddenly drop to a dangerous level is often not due to the doctor's prescribed medication. In reality, this condition can directly come from a supplement ingredient that is widely promoted for its ability to support blood pumping and enhance cardiovascular health. I once treated a male patient over 60 years old. He was taking his prescribed antihypertensive medication daily, exactly as instructed by medical guidelines. However, he decided on his own to add a dietary supplement containing L-arginine. After he combined this supplement with his prescribed blood pressure medication, something serious happened. He fainted inside the bathroom. When the emergency team received him, we recorded that his blood pressure had dropped sharply to a critical level. The combination of these two substances caused excessive lowering of blood pressure, meaning the blood flow no longer had enough force to reach the brain. This led to reduced cerebral perfusion and an immediate loss of consciousness. In addition to the fainting episode, the patient also reported feeling severe dizziness, blurred vision, and a sudden sense of weakness in his limbs prior to collapsing. These symptoms are typical warning signs of acute hypotension, which occur when the brain temporarily receives insufficient oxygenated blood. In elderly individuals, such a condition can be particularly dangerous because the body's compensatory mechanisms are often weaker and slower to respond. From a medical perspective, L-arginine is a substance that, when entering the body, stimulates the production of nitric oxide. The main function of nitric oxide is to dilate blood vessels, or in other words, to significantly increase the diameter of blood vessels so that blood can circulate more easily. The antihypertensive drugs prescribed by doctors also work by relaxing and dilating blood vessels in order to reduce blood pressure to a safe range. When you take L-arginine at the same time as blood pressure medication, your circulatory system is exposed to vasodilatory effects from both directions. Both substances simultaneously force your blood vessels to expand further. This combination creates a potentially dangerous pharmacological interaction. When blood vessels are excessively dilated, the internal pressure of blood flow within the vascular system drops suddenly. As a result, blood pressure can fall steeply and become difficult to control. At this point, blood circulation no longer has enough pressure to reach the brain and other vital organs, directly causing cerebral hypoperfusion and fainting. Moreover, this effect can be more pronounced in older adults who are already taking multiple medications or who have underlying conditions such as dehydration, electrolyte imbalance, or weakened vascular elasticity. In such cases, even a moderate additional vasodilatory effect can be enough to push blood pressure into a dangerously low range. Absolutely do not take additional supplements on your own while using antihypertensive medication. If a product contains L-arginine or is labeled as nitric oxide booster, you must consult your doctor first. This helps directly prevent dangerous drug interactions that can cause sudden drops in blood pressure and threaten life. L-arginine can lower blood pressure immediately, but there is still another medical risk coming from your very own relaxing evening cup of tea. This beverage increases urination, continuously flushing out important minerals through the urine. These minerals are essential for maintaining stable contraction rhythm of the heart muscle. I will explain that right now. 5. Licorice root and potassium imbalance. The cup of herbal tea you drink every night to fall asleep easily is the exact cause of your irregular heartbeat. Many older adults choose teas with a natural sweet taste because they believe they are safe. However, the medical truth shows that the ingredients in the tea directly interfere with heart muscle activity. This habit creates a severe mineral imbalance in the blood, directly causing the heart to beat out of rhythm and continuously pushing blood pressure up without you even knowing. The component that creates the characteristic sweet taste in licorice root is the active compound glycyrrhizin. When entering the body, this substance acts directly on the filtering function of the kidneys. Under the impact of glycyrrhizin, the kidneys will alter their excretion mechanism. Specifically, it causes the body to retain a massive amount of sodium salt, along with water, while simultaneously increasing the level of potassium mineral excreted out through urine, This process causes the potassium concentration in the blood to drop low. Medically speaking, potassium is a strictly required mineral to maintain the electrical impulses and the stable contraction rhythm of the heart muscle. When the blood is deficient in potassium, the heart muscle cannot maintain a normal beating rhythm, directly causing a condition of cardiac arrhythmia. Furthermore, the body retaining too much salt combined with the potassium deficiency state will cause the blood vessel walls to constrict and narrow. When the space inside the blood vessel shrinks, the blood flow pressure is forced to increase. The actual consequence is that your blood pressure reading will be pushed to a very high level. I once treated an elderly female patient. She strictly adhered to an extremely low salt diet to control her blood pressure. However, her blood pressure still continuously spiked. She also frequently experienced a very fast and forceful heartbeat, despite no strenuous physical activity. Analyzing her habits, I discovered the direct cause came from the mildly sweet cup of herbal tea she drank every night. This sweet taste was from licorice root. Even though she ate a bland diet, the licorice root still interfered with her kidney function, forcing her body to retain salt and continuously flush potassium out through her urine. The deficiency of potassium in her blood was the direct cause, making her heart beat abnormally and pushing her blood pressure to skyrocket. Therefore, you should not be complacent with your daily beverages. Right now, go to the kitchen and check the ingredient labels of the herbal tea boxes you are currently using. If the label says licorice root or rare cam tao, please temporarily stop using it immediately. Especially when you are being treated for high blood pressure, stopping the consumption of this type of tea is a mandatory medical step to prevent the kidneys from excreting potassium, helping the blood restore its mineral balance and maintain a safe beating rhythm for the heart muscle. When knowing the body is lacking potassium, the reflex of many people is to immediately go to the pharmacy to buy potassium supplement pills to compensate. Absolutely do not arbitrarily do this. Loading up on high-dose potassium pills when you do not yet have blood test results is an extremely dangerous medical risk. It directly causes a condition of acute hyperkalemia, high blood potassium, disrupting the heart's electrical system and potentially causing the heart muscle to stop contracting completely. High-dose potassium tablets and kidney risk. I once received a serious emergency medical case directly related to the self-use of mineral supplementation. An elderly male patient, after learning that potassium can help lower blood pressure, went to a pharmacy and independently purchased high-dose potassium tablets to take every day. He continued taking them for several weeks. After that, he was brought to the hospital in an emergency condition with extreme fatigue and difficulty breathing. Electrocardiogram results and blood tests showed that his heart rate had slowed to a dangerously low level and his kidney function was rapidly declining. The direct cause of this condition was that he had absorbed an excessive amount of potassium into his bloodstream. This excess potassium was not eliminated in time, so it accumulated in the body. The abnormally high potassium concentration in the blood directly disrupted the heart's electrical system, causing the heart muscle to contract very slowly. At the same time, the kidneys had to continuously filter this high concentration load, which led to overload and acute kidney dysfunction. In addition, the patient's condition worsened because he had mild, pre-existing kidney impairment that had not been diagnosed earlier. This is very common in older adults, where kidney function can decline silently without obvious symptoms until a serious event occurs. In such cases, even a seemingly simple supplement can become dangerous when the body cannot regulate electrolyte balance properly. From a medical perspective, the kidney's filtration function naturally declines with age. In people over 60, the kidneys no longer have the same ability to filter and excrete excess minerals quickly as they did when they were younger. When you consume potassium through natural foods, such as eating a banana, the digestive process occurs slowly. The potassium is released and absorbed into the bloodstream gradually. This allows the kidneys enough time to process it and maintain mineral balance within a safe range. However, when you take high-dose potassium supplements, this mechanism changes completely. When the tablet dissolves, a large amount of highly concentrated potassium enters the bloodstream almost all at once. This sudden surge of minerals exceeds the working capacity of the aging kidneys. When the kidneys become overloaded and cannot excrete potassium efficiently, the excess potassium accumulates in the circulatory system. This condition leads to a dangerous disorder called hyperkalemia. Potassium is a key mineral that controls the heart's electrical signals. When potassium levels rise sharply, it disrupts the entire cardiac electrical conduction system. The most serious medical risk is that this condition can directly cause the heart muscle to stop contracting altogether. Even a moderate increase in potassium levels can already affect muscle strength, causing weakness, heaviness in the limbs, and abnormal heart rhythms. This is why potassium balance is considered one of the most tightly regulated systems in human physiology, especially in elderly patients or those taking blood pressure and heart medications simultaneously. Getting potassium from natural foods is safe and helps stabilize blood pressure. In contrast, high-dose potassium supplements carry serious medical risk. You must never self-administer any potassium tablets. You are required to have a blood test to check your actual potassium level and only take it under a specialist doctor's prescription and direct dosage supervision. From the risk of taking vitamin D without K2, the danger of oxidized fish oil, fluctuations caused by L-arginine, to the unexpected effects of licorice root on the kidneys and heart, we can clearly see any lack of understanding about dietary supplements can push your blood pressure into a dangerous state. So how can we combine all these complex medical warnings into a safe, precise, and easy to apply rule for daily health protection habits? We will solve this problem right in the next part. At the core of all these cases is a single important principle. The body's balance depends not only on what you take in, but also on how well your organs can process and regulate it over time. Based on the 6 medical analyses above, the safest rule for older adults is never treat dietary supplements like candy. Every capsule you put into your body can directly interfere with heart rhythm, kidney function, and the elasticity of your blood vessels. Self-combining these supplements with antihypertensive medications without medical supervision is essentially putting yourself into a life or death gamble. The only truly safe solution is this: before purchasing any type of supplement, ask your doctor to perform a blood test. Only real biochemical indicators can accurately determine what your body is truly lacking and what it is already in excess. Bring all the supplement bottles you currently have at home to your next regular medical checkup so that your doctor can review them and eliminate any potential risks of drug or supplement interaction. You should prioritize obtaining nutrients from natural food sources, calcium from nuts, potassium from green vegetables and bananas, and omega-3 from fresh whole fish. The aging human body is designed to absorb nutrients slowly through natural digestion, not to handle sudden high concentration doses from chemical tablets. Cardiovascular health is not determined by how many types of pills you take, but by how accurately you understand what you are putting into your body. If you find these medical insights helpful and want to continue following along to protect your health every day, please subscribe to the channel and share this video with your loved ones. Thank you for watching, and I will see you in the next videos.